What parents need to know about choosing a therapist for their child. Written by Calvin A. Colarusso, MD. Narrated by Ken Maxon. Copyright 2011 by Calvin A. Colarusso, MD, all rights reserved. Published by True Nature Productions. Introduction. When a child is having emotional or behavioral problems, parents become not only concerned, but also may need to seek professional help. When lesser measures fail, the next step may be finding a child psychotherapist. Many parents have no idea who to turn to or how to assess the qualifications of such a professional. What can be expected during an evaluation? If therapy is needed, what is the therapeutic process? In this audiobook, I will address those questions and provide information and guidelines to help you through a difficult time, which, with the proper intervention, could turn into a great benefit for your child. As you'll see at www.calbooks.info, I'm an adult and child psychiatrist who has been evaluating and treating children for 5 decades. I understand how difficult it is to face the reality that your child is in need of help and to find the right person to intervene. Let's begin with an understanding of the various mental health professionals who evaluate and treat children and how their credentials differ. Credentials. A child psychiatrist is a medical doctor who has chosen to specialize in mental and emotional problems. In order to become a psychiatrist, a man or a woman must have graduated from medical school, likely spent a year as an intern, and then spent at least 4 years full-time in adult and child residency training programs. 2 or 3 of those years would be spent in an approved program working exclusively with children. Not every psychiatrist is a child psychiatrist. So when considering a physician for your child, ask specifically if the person has completed a residency in child psychiatry in addition to the years of training in adult psychiatry. Physicians are the only professionals in nearly all states who are licensed to prescribe medication. Psychologists also treat children. They go through a lengthy graduate school program that can take 5 or more years to complete. After graduating with a PhD, psychologists spend a year or more in a clinical setting working with patients under supervision. After passing a licensing examination in their chosen state, they are ready to begin a practice and see patients. If you are considering a psychologist for your child, you should inquire about that person's specific training and experience with children. Social workers also treat children. They undergo 2 or more full-time years of training in social work before becoming licensed to practice. As with child psych.
Sample complete. Ready to continue?